Okay, it's Dr. Schaefer here, and I'm in my home office and just learning how to use, I guess, record online videos. So my son Michael just helped me set this up. Pretty easy, actually. All you do is find a little program online through Google, and Google really makes this simple. So I think you can see on the screen that I'm part of a group, Premier Orthopedics. I am a interventional spine physiatrist, and I've been working with Premier Orthopedics for 10 years now, and doing this type of work for 20 years. And here on the screen is a newsletter that's being sent out, I think, pretty quickly. Um, I'm this guy, if you can't recognize me. I just woke up this morning, so not really prepared to be on video, but thought I would give it a shot. Um, what I would like to talk about, and really what I'm excited about letting everybody know, is a procedure that is very effective in treating chronic low back pain. There's been really not a lot of great advances in getting rid of back pain. And like I said, I've treated patients for 20 years, and what I see is a lot of frustration from the patients because they are told from the surgeon that to get rid of low back pain, surgical interventions are really not that effective. Um, Now, surgeons are great at opening up spaces, getting rid of spinal stenosis that's causing pain radiating down the legs. But with back pain, surgeons really have not been able to solve that problem, which I think is one of the things that led to my field, which is a medical field. So a non-surgical field, it led the way for us to really do a lot of research and try to figure out and treat patients with chronic low back pain that are not surgical candidates, which really is most of the patients. There is a procedure called radiofrequency neurotomy that I've been performing off and on for 20 years. But really, only in the past 10 years has the research been done and really the understanding of how to make this procedure highly effective. Um, Not just my understanding, but really across the United States and across the world, because I am a member of the International Spine Intervention Society for about 20 years. Um, it wasn't just me who did not know how to use this procedure effectively 15 years ago. But now, with a lot of research, we've figured out how to make this radiofrequency neurotomy machine and procedure highly effective in treating patients with chronic low back pain. By the way, if you're over the age of 59, the research is clear, and also my personal experience is clear that the most common cause of pain is from lower facet joints. And I think you can see on the picture here a diagram of the facet joints. And this procedure, radiofrequency neurotomy, it relieves the pain from these facet joints. So the research shows us that 40 to 60% of you, or 40 to 60% of patients that have chronic low back pain and that are older than 59 years old, which is the most common age of patients with back pain, are really aged patients or the elderly with chronic low back pain. This procedure is great, and it's simple to perform. It is comfortable for the patient, and I keep repeating myself. It really is highly effective in the right patient and performed with very specific techniques. Uh, so there's a lot I could talk about, and I'm not sure or certain how much of this you can read in here. But I'll go over a few of the points or the main points, important points regarding this procedure. Number one is when I first started doing this procedure, when I was trained to do this at Stanford's Interventional Spine Center in Northern California, and I worked with some really famous interventional spine physicians like Richard Derby and Young Chen. And now the head of interventional spine at Stanford is Matt Smuck, who was one of my classmates in residency and friend. What we were taught, the best way to perform this really didn't work very well. So for the first 10 years of my practice, I did not perform this procedure very much at all. It wasn't until a meeting of the International Spine Society in really, I think 2009, I think it was, when I go annually to these meetings. And it's weird that the camera's like this, like my eyes are sideways or something. Oh, that's a little bit better. I'll take this time to drink a little water. I was saying that I went to this meeting and I listened to a presentation and I heard and I spoke with some physicians. One in particular who was telling me that he gets excellent results, near 90% results performing this procedure. And I said, well, that's really surprising to me because the way I was taught and how I do this procedure, it really doesn't work very well. And he offered to let me come watch him do the procedure and talk to his patients. And it turned out he was only one state away. So I took a day off from work, drove up to a surgery center, and spent a day in New Jersey really learning from somebody, learning a technique from really a chronic pain management doctor, uh, learning this technique that turned out to be absolutely wonderful, and it did work great. So I watched him do 2 or 3 cases in the operating room with him. I talked to the patients afterwards, one of which who had the procedure a few years before, and then the procedure, and then needed it repeated. And sure enough, the patient said that, yeah, it took away 100% of the back pain for a year or more. And when the pain returned, he was anxious to get the procedure repeated and learned that he thought the procedure was comfortable. The procedure took about 45 minutes to complete that day, and I decided to learn more. So thankfully, through the Interventional Spine Intervention Society, they offer cadaver courses multiple times in multiple states and sometimes different countries throughout the year. And I found a course uh, that's teaching other techniques on how you do this radio frequency neurotomy. And really, since that time, I've gone to, I think, 3 cadaver courses that are totally focused on radio frequency neurotomy. And we try to work with and what the society does is try to pull the people that get the best results from these procedures to teach these procedures using a cadaver. So we actually practice doing the exact procedure that we would do on a live patient on a cadaver. And by practicing on a cadaver and listening to experts on these procedures, we're able to proliferate the information of how to make other physicians excellent at performing procedures. So after 2009, by 2010, I started to get more comfortable uh, that I could do this procedure in a way that I could relieve most of patients' back pain. Um, and from then, 2010 till now, I've done over 500 of these procedures, and I've had the majority of my patients have been very happy. What I found is that I've had pain relief in patients that lasted from 6 months to over 4 years. Most recently, I had a patient come back and tell me that I did the procedure 4 years ago.